Let's bring in Dr. Ron Elfenbein. He's an emergency care physician and author of Surviving Coronavirus, an ER Doc's Perspective. Dr. Elfenbein, from your perspective, just how bad is the situation in the Midwest?
Good morning. It's very concerning. You have areas that previously had not been hit particularly hard, specifically these rural states that are now getting hit very hard. The numbers, as you said, Vlad, are going up in these states and across the country, and it is concerning. But it's, again, as we've said before, not unexpected given the weather change, and we know that coronaviruses are more active in the cold, dry air. So as the weather gets colder and colder, specifically in the Midwest, which is going to get, and then the western states, which kind of get hit first, it's to be expected that the numbers will go up, unfortunately.
All right, so for those who plan on voting in person, do you have any advice, so they can do so safely?
Yeah, absolutely. I think it's the from what I've seen, my wife just actually voted on Friday in person and in Maryland, and she said it was a great experience. I think what I've seen and what I've heard from people that I know that voted in person, I voted absentee because I'm working on election day, but what I've seen and heard is that the local governments have done a very good job of keeping it as safe as possible by encouraging social distancing. People have been responsible, wearing masks and showing up, and everybody that hands you things and stuff at the polling sites are in gloves and masks and doing things appropriately as they should be. Again, I mean, that's anecdotal. I haven't been around the country. I've just been, from what I know, in Maryland and talking to people who have voted. They've done a very, very good job of keeping it as safe as possible. So what I would encourage your voters to do is not be afraid to go out and vote if they choose to do that. And I would encourage them to do that, and to wear a mask, to maintain social distancing, to bring a vial of hand sanitizer, wash your hands constantly, just be vigilant like we always talk about, and just be safe and be careful. But it's nothing different than going to the grocery store or anything else. There's no reason to be more scared to go vote than to go buy your groceries, to go buy your milk, to go get your mail, whatever it may be. Running errands, just consider this another errand, but just be careful and be safe about it.
So, Dr. Elfenbein, at midnight, President Trump held a rally in Florida where the crowd was chanting something about Dr. Anthony Fauci. I want to play a bit of that.
Don't tell anybody, but let me wait till a little bit after the election.
So we should note that perhaps somebody should tell the president that he doesn't have the power to fire Dr. Anthony Fauci. But how is the president's comments and sort of the leading of that chant, or reveling in that chant, being received and perceived in the medical community? In other words, for the doctors who are on the front lines, who are following the CDC guidelines, who are trying to save people's lives, who are themselves at risk every time they walk into a hospital where there are a number of COVID cases. What are you hearing from your colleagues in the medical community?
Well, I think on the one hand, he's trying to play to his base, and he's trying to, rally up the crowd. And I think that's somewhat political theater. But my colleagues and I think that we don't appreciate that very much. We don't appreciate being sort of told that we're fudging the numbers. When he said that doctors are writing everything down as a death for coronavirus, I think his point was that it's very hard to compare numbers of deaths from coronavirus from country to country, because different countries use different standards on what constitutes a coronavirus death. But the way he said it, and I think what the clip you just played, I think does not play well with physicians and nurses and techs and people who are working on the front lines, as you suggest, or as you say, Vlad, to exposed to this on a daily basis and risking our lives. It is kind of a slap in the face.
I want to switch gears a little. Thanksgiving is just a few weeks away. certainly many people across the country are going to forego their traditional festivities. But doctor, there are going to be people who are going to travel. Many people have not seen their loved ones perhaps since January, and this will be the holiday that they travel. Do you have any advice or anything that you think that people should consider before they venture out?
Yeah, thanks for asking that question. It's a great one. I think people need to look at a couple things. Number one, where are you going? Number two, who's attending? And by that, I mean how many people are attending. The higher the number of people that are going to be attending, the higher the risk to you and to everybody else that's there. Where are you coming from, or where are people coming from? And, I just had this discussion with a family member of mine, actually, who did have a small get-together for a holiday recently. And, one of the things I suggested that my family member look at was, who's coming? And by that, I mean, obviously the number of people, but also how careful are these people being? One person in particular that was supposed to come to this event was a young, kind of reckless individual who wasn't known to be, maintaining social distancing and wearing masks and going out a lot and stuff like that. So, that's a hard question to have to ask your family members. Hey, are you being careful? Hey, are you wearing masks? Are you maintaining social distancing? And if not, you're not invited to Thanksgiving. I mean, that's a tough thing. That's a tough conversation to have, but it's an important conversation to have. And, you're talking about a potentially deadly virus that nobody wants to get. So, these are conversations that I think that if you're going to have a family get together, these are the kinds of things you have to ask these people who you're inviting. Where have you been? How careful are you? Where are you coming from? How are you getting here? What's your means of travel? All these things are important. And I think that, they need to be really looked at, and you need to have these difficult conversations with your family.
Let me ask you a quick question, Doctor. So many of you may know that I am originally from Canada. So Canada has their Thanksgiving in October. So this is a conversation that my Canadian family has already had. And there are a few people in my family that are, not so sure that the coronavirus is as contagious as doctors say. And we also have a number of older people in our family in their 70s. And so the decision for my family was not to get together at all. They had sort of Thanksgiving in their nuclear groups, but not the larger Thanksgiving dinner that we normally have. But I wanted to ask you, if you decided now to sort of self-quarantine, 2 weeks where you were not going to go out, you're not going to interact, if you work from home and then you continue to work from home, but could you reduce the risk if you decided now to sort of self-quarantine, or is that not even a sufficient enough sort of protective measure?
No, I think that's a great point. If you're willing to do that, and everybody's willing to do that, you're definitely reducing your risk. By all means, that would be fantastic if people would all do that. But you got to make sure that everybody's really adhering to that. Everybody's really doing that. I mean, remember, all it takes is one little slip up, and you can potentially infect yourself. Again, I'm not a doom and gloom person. I'm not trying to scare people. I'm just trying to give you objective sort of advice about what to do. And your question's a good one. If people are willing to isolate for 2 weeks, then it doesn't get much better than that, because even if you have the virus and you're asymptomatic, by that point you're going to be gone. It's going to be gone from your body. So, and you're not infectious anymore. So yes, but that is the best of all worlds if people would be willing to do that. But the other question is, how are people getting to your event? So if you're in New York and your family members are in Florida and they're coming, they're going to have to fly or drive, and they're going to be exposed along the way. So again, these are all things that you have to weigh and have to ask your family members, because they're all good questions and they're all relevant and they all carry risk. And you kind of have to look at a risk-benefit chart. And again, I hate to put this in clinical terms, but do the risks outweigh the benefits, or the benefits outweigh the risks? And you kind of have to look at it that way and say, how bad are the risks? And I haven't seen my mother in a month or in a year or whatever, and I want to see her. I want to see my father. I want to see, how important is that to you, and how much of a risk are you willing to accept? And, people just have to have these frank discussions with their family members. It's a hard thing to do, but it's something that you really need to do. For example, we're planning on going to go visit my family and my wife's family over Thanksgiving, and we're all going to get tested before we go, because we don't want to expose our family to the virus. And we're going to be very careful on the way up. And, we understand the risks, they understand the risks, and we've had these discussions. So, I would encourage everybody out there to not be afraid to bring it up and talk about it before you decide what you're going to do.
I think those are all great points. Dr. Ron Elfenbein, thank you so much.
Thank you. Stay safe.